So now we're getting back to that same survey of U.S. nurses. And what this one talks about is what activities nurses are reporting that they're doing in the light blue and what they want to do more of in the future. So what I want to actually highlight more than anything are the areas that they want to do more of in the future that I think would be of benefit to nurse leaders and to nurses everywhere. So regular exercise was 41%, but 66% want to either continue it or to add it in. Maintaining a balanced, healthy diet at 27%, and 56% want to see it in the future. Practicing mindfulness or other relaxation techniques, 25% were doing it. 35% were wanting to do more of it in the future. And again, training in wellness and stress management was 10%. And with, in the future, they would like to double that. Again, another feedback slide from this survey. What I want to stress to you are the bottom ones. So first of all, what I'd like to say is that the employer values my mental health. That is the lower one. And even though it's in agree, I think that what we need to think about is how do we increase that? So also, how does our employer understand the responsibilities outside of work? That also is lower than I think we would like it to be. We would like to see these move up higher. And these are things that we can do. These are strategies that we can target as nurse leaders. And also, I would like to have them try out the wellness and health promotion resources in your organization. So these are areas that we really want to focus in on as nurse leaders. So how do we do that? We're going to start with mindfulness, communication, and leadership. We need to be present. So that's using mindfulness to be present in the moment. Listen. Give your team space. Remember that not being present is apparent to others. And when you listen, use your ears more than your mouth. Make eye contact. Reflect back by using their words, showing that you are listening, that you are connecting with them. Avoid telling others what to do, but respond with kindness and compassion. Be observant. Share your observations with them with compassion. By using your senses, I noticed that you look tired. How are you doing? You sounded more abrupt when you were responding to your fellow nurse. How are you doing? So again, we want to be careful that we don't tell people what to do or to accuse them or put them on the defensive, but respond in an open way to give them a chance to respond back to us. So we want to normalize and accept their feelings, to be present. I can't emphasize enough being present. So with the continued work demands, family needs that need to change from day to day, and negative news of local and national events, conflicting political messages, it's important that they recognize that sometimes they need to talk to other people, including yourself, and to ask for help. So one of the things that you could say is, I and many of our colleagues are finding it very hard to function well under this now chronic pandemic stress. And when stress gets to be too much, we don't function well in any of the areas of our life, and that can make us feel even worse. And talking to someone neutral can help unburden the feelings. As a nurse leader, it's also acting as a guide. Have you thought about talking to someone else about how you're doing or feeling? I have found that our employee health nurse is very helpful, and so can primary care providers. Our employee assistance program is here for all of us. And our health insurance company can give referrals that meet your needs. But also offer to help. What you have to understand is that caregivers are hesitant to seek help out for themselves. They have a fear of being seen as weak. I can't take care of others if I need to care for myself. Others will see me as weak, unable to do my job. Fear of negative consequences with their position or employment. So with compassion, we need to reassure them that seeking help is a healthy step, that nurses need care too, to better provide for their patients, and that there is no judgment for seeking help. Offer to help schedule an assessment. Walk them to the EAP office. Call and get some resources or referrals for them if you feel like that they need that extra support and help. So how else can leaders help? I think I gave you a lot today, but I want to go over some things that I think many people have said multiple times, but it bears repeating. So again, visible leadership, be present mindfully. If you can't talk to someone when they're stopping you in the hallway, tell them that you'll get back to them and tell them when you'll get back to them so that you can listen to them fully. Practice compassionate leadership. Provide anonymous staff help connections so that they can reach out without other people knowing that they need help. Share a connection with your team. Go down on the units or go to another unit and share what other people are doing. Let them know that they're not the only ones and that you greatly appreciate all that they're doing and the amount of work stress that's on everyone. So share efforts to support them and you. Be open, honest, with clear, consistent information, and provide those digital mental health resources that Holly was talking about earlier. You can also have small groups where staff talk about how they protect their families and loved ones. I know some people go in through the garage, strip down, throw their clothes in the washing machine, and head straight to the shower before they stop and talk to anyone in the house. And I'm sure there are other tips that people are willing to share. You need to be able to recognize that some staff will need flexible schedules in order to attend personal or family needs. They need access to healthy meals during shifts. You saw that list that they had of what they were doing, but also what they wanted to do more of, and eating healthy was part of it. That they need adequate supplies and personal protective equipment. Take your pulse of your staff through a stress survey. That's letting them know that you are interested in finding out how they're doing. And most of all, take care of yourself as their leader. I can't stress enough, though, that your plan for supporting yourself and your staff needs to be for at least a year after this pandemic crisis occurs.